Welcome to a series of podcasts from UPrime. Today we have Mahesh with us. Mahesh, how are you doing?
I'm good.
So, what do you think is the experience that you have felt about healthcare system in India broadly?
This experience reflects the misery of someone close to me. Due to healthcare inefficiency, the problem got increased instead of decreasing.
Okay.
This caused waste of money, time, and affected the health person's health. After switching multiple doctors, cities, hospital, the disease got diagnosed and the surgery was done. But after the surgery, the disease remained. So
Okay.
now they are financially drained because the testings and private hospitals are so costly. After like for 8 to 10 months, they have been moving here and there for the problem. So
So, majorly the problem is with regard to the cost, is it?
yeah, the main problem is regarding cost. Things private hospitals are so costly and government are cheap, but you can only have 2 or 3 names of government hospitals which are good, and getting their appointment is too tough. So and private hospitals are too costly and testings are even more costly.
So, what are the major problems that you felt? Like, if you have to list it out, what are the major problems? It's the cost.
Cost and like I told someone who were close to me are from some rural areas. So in rural areas the healthcare system is not so good.
Okay.
Like we have to move to cities, but after coming to a good city also they are not able to get proper diagnosis. They have to switch multiple times in cities also.
And if there is a rare case, let's say, how long does it take before you can actually narrow down the diagnosis?
Actually the problem was like this was a special case only, but some doctors are like that, they won't see previous doctor's report, they will do the same testing again over time. Like i I read somewhere like a blood report test is valid for 3 months, but if you visit a doctor, like you have done a blood test today and you visit a doctor after 20 days, he will give you again the same blood test. They won't see the previous test, and they are so costly, like 1500 2000 rupees blood test.
Okay. And you're saying that because of repeated testing,
Yeah, means one doctors do a same testing 3 or 4 times. He is like I'm not able to diagnose the problem, so he will say that I will do the testing 4 5 times, same testing,
okay.
and they won't refer to the previous doctor's testing. They won't read the previous doctor's report. They will do their own.
This report is readable, right? Machine
Yeah,
readable.
they readable. They are all readable.
But they would refuse to do it.
They would refuse. They will do their own, and they won't. And some doctors are they won't even if you if they will say you for testing and you do somewhere else instead of their hospital, they even don't read the readings also.
Okay.
They want it to be done in their hospital only, testings.
Okay. Okay. So majorly, if I understand it right, the cost is an issue. Uh, you know, cross-platform compatibility of test results. Platform here would mean different doctors. Let's say there are two doctors and each one of them has their own testing center. There should be a way by which one doctor's testing result can be read by another doctor.
Yeah.
At least the test results.
Test results can be read by another doctors.
But that is not there right now.
That's not there.
As a result of which there is repeated testing.
Repeated testings, like they had done biopsy near about 8 to 10 times.
Biopsy, okay. 8 to 10 times, okay. So, what do you think is the solution for problems like this kind?
We need a proper system, proper healthcare system, which now people are also not in a means people also don't have a lot knowledge about medical science. That's the main problem. Like if doctor said that you have to do this testing, you have to do, because we don't have proper knowledge. If we find something that we can read about some basic medical science at our home, this will be very good. Like
Okay.
some basic medical science.
So, you're saying basically this is a case of, as academics call it, information asymmetry, wherein like one party has far more information than the other party.
Than the other party.
As a result of which you don't have a choice in terms of the treatments, or in terms of even the basic information that you get from that person. You have to just trust and hope that things would work out. And if it doesn't work out, you go to another doctor. He will make you undergo the same test again, and you have to just go through these procedures without asking.
And we have to do it again, and these testings are somewhat painful also. They are not like easy. They will take your blood like endoscopy, sigmoidoscopy. These tests are really little bit painful.
Okay. So if there has to be a system, that's your solution. So if there is a system, do you think like doctors would be fine with a system like that, because it will hit their bottom
Doctors
line?
are really thinking for the patient health, then they would be fine.
Yeah.
They should be fine with the system if they are really thinking for the patient health, not for their income or.
Yeah, I can understand. But that's one. Compatibility of test result sharing is one big aspect. That is something that we can highlight. And if there's a system which can take these test scores and give it to some other doctor someplace else, that is something that will be of a lot of use, right? So, do you think doctors are compassionate with patients when it comes to rare cases for which diagnosis is done and treatment is done and the results are not up to their mark?
In some cases we can say, but not fully. We can't say like fully.
Okay.
But sometimes it's true. Like there are some diseases.
What is true?
Some diseases are like which are incurable. I understand, but even the doctors don't prefer other doctor also. If they are not able to solve the problem, they won't say like move to the other doctors or shift to other doctors. They will waste your time. They will continue it for 30-45 days. They will do the same testing, and they will say like we are trying our best. We are trying our best. Even they won't recommend you other doctor also. Like there are some best doctors in India. There are, but they won't recommend you.
Okay, so what kind of choices do you face when you encounter a situation like that? You just have to go through what the doctor says.
Because I told like we don't have much medical science knowledge. We don't know. They are saying like we heard some of the treatment first time, like FMT. I have never heard about this thing before. So there are some technologies which I have heard first time, FMT, and there were some Clostridium infection. I get to know about this type of things. So if we were familiar these words, then we can, with familiar these technologies, then we can do something else also. Like we can.
So if you want to give out some message to the healthcare community overall, doctors first, what is that one message that you would want to give out to the doctors?
I would say like sharing reports and testings can be minimized. Testing cost can be minimized because testings are so costly. Like doctor fees is really not so big issue, but testings are so costly.
Okay.
So some private hospitals can minimize their testings.
Okay. So that is the only thing that you would want to tell the doctor?
No, like they can. They're also like I told, like doctor can recommend us other doctor if they know that we are not able to get the diagnosis. They can recommend other doctors because they have been working under a lot of doctors.
Yeah.
They also have experience. They know other doctors of their same field, so they can recommend. But we didn't get any recommendation from doctor side.
So how does the recommendation work right now? So they just tell you there is a friend of mine who is.
They will suggest the patient name, not doctors. They will suggest like I have treated this patient. I have treated this patient. You can consult with them. They will never recommend us any doctor.
So you're saying you had a situation wherein there was a scenario wherein you did not get the cure you wanted, and the doctor advised you to consult a previous patient of his or hers?
Of his and hers.
Yeah, okay. So then you contacted that patient and they recommended you what exactly?
They recommended us some other doctor also. Like they said that we visited other doctors and get suggestion from them also.
So basically there is no information flow from one doctor to the other?
Other doctors.
Okay.
This can be improved
In a dramatic manner, because if there is a system wherein you can recommend it systematically, it's much more easier on the end user who is a patient, as opposed to patient consulting other patients and then finding their recommendation. because that might not even be right. You don't really know what the patient would suggest. Okay. Is there anything else you would want to say to the medical community overall, not the doctors, let's say other medical community that you have encountered?
They can provide some useful data.
Okay.
That's what, like, so that people can be aware of the disease.
Okay.
Like how this disease is affecting others also.
Okay.
How we can get treated. Like people can get the solution in home also. I want that kind of thing. Like people from a rural area can't move to city and they have to change their cities.
Okay.
Like if we get some help in home, that's the best part.
Okay. So to conclude, Mahesh has given his views on the kind of changes that he would want to see in the healthcare system that exists in India. I would like to thank Mahesh for sharing his views on the healthcare system in India. Thanks a lot, Mahesh.
If you like our channel, don't forget to like, subscribe and share with your friends.